As the COVID-19 pandemic continues, healthcare workers are among those in the most danger of getting infected while trying to save lives. Our Brandon Merano talked to a Washington University emergency room doctor working at Barnes Jewish Hospital about what life is like on the front line.
These patients are very sick.
They're the front line of defense against COVID-19.
I think the most impactful bit is the stories of the people that we take care of.
Yes, I talked to a gentleman who couldn't be there when his wife was dying from this disease. You know, it's mothers and sisters and brothers and cousins and grandfathers and grandmothers.
Typically, my rule is no one dies alone. And this has been really challenging from that. And we are trying to do our best to work around it.
To do that, Dr. Tiffany Osborn is using things like Zoom and FaceTime so patients can talk to their families during their final moments.
I believe that the heart gets what the brain doesn't. So I think the heart understands what the brain doesn't. I believe that on some level, people who are dying, even if they don't know the exact words you're saying or how long you're there, they know who's talking to them. I've seen too much not to believe that.
But the fight on the front line isn't the only battle Dr. Osborn is fighting.
And it's been physically and emotionally exhausting.
She's living in a camper in her driveway, quarantined from her children and her husband.
Having experience with the military and deployments, this is basically her deployment for the war on COVID.
While the numbers of patients coming into hospitals is plateauing, Dr. Osborn says it's more important than ever to continue social distancing.
I'm still living in a camper in my driveway. It is not time for us to stop the shelter in place.
But when that time comes, you can bet there'll be few people more excited than Dr. Osborn.
We're close to the end zone. Don't drop the ball now.
So she and other healthcare workers can safely return home to their loved ones. In St. Louis, Brandon Merano, 5 on your side.
Dr. Osborn also tells Brandon they are sharing protective equipment and other resources with other area hospitals, but donations are still welcome.